Hi, everybody. Welcome to Hey Doc, What's New in Plant-Based Medicine? I'm Lisa Carlin, your host, and I am so excited to have one of my very dear friends, Dr. Angie Sadeghi. We are really friends, but she's also a phenomenal plant-based doctor. And Dr. Sadeghi, welcome to our show.
Well, thank you so much for having me. I just love you, and your show is rocking it.
So I want to know, my first question is always, hey Doc, what's new in plant-based medicine?
So many things. Well, three things. Number one, for many years, we have known that a plant-based diet can be helpful in regards to diabetes and metabolic disorders and heart disease. But the emergence and the importance of the gut microbiome. And we know that there are 100 trillion gut microbiome living in our gut, and they thrive off of a whole food plant-based diet. That's number one. Number two, I just found an organization called the Institute of Plant-Based Medicine, and we have several of your favorite plant-based doctors, and we're ready to serve you. And we're launching on July 25th, and we're ready to see patients as of August. Of course, number three is that, you know, we have, I'm sorry, can you see me, Lisa? I feel like
yeah,
disconnected.
You're on the screen. Yeah, you're beautiful.
Okay, number three, you know, I'm meeting more and more physicians every day who are joining in this movement as plantricians, which means that they emphasize integrating nutrition with medicine to be more powerful.
That's phenomenal. I just think it's absolutely phenomenal. So I want to play something for our audience. Remember, you did a video for $1 Million Vegan a few months back, and I think it's a great way to start off. So I'm going to play that video. It's about 2 minutes long, and I'll be back. So everybody, please enjoy this. Angie Sadeghi with on the $1 Million Vegan platform.
70% of the population is lactose intolerant. Why is it legal to eat dairy? It should be illegal. If they conducted a study and it shows 70% of the participants in that study were damaged from it, would the FDA approve it? The answer is no. So why is dairy legal? I was a vegetarian for animal cruelty reasons, and I had zero idea about the health benefits of a plant-based diet, just because simply we're not taught in medical school, and we know very little about nutrition at that point. I had never heard of all of this literature indicating how beneficial a whole food plant-based diet could be for health. So at that point, I realized, well, you know, the cruelty reasons are there, the environmental reasons are there, but there's a whole lot of health benefits out there that I was oblivious about. So I dug in and I've studied it. It turned out the dairy proteins, whey protein and casein, those two proteins are inflammatory. And many people get sinus problems from it, many people get skin conditions from it, many people have allergic reactions to it. So many times I have patients who come and tell me their doctor said, your inflammatory bowel disease has nothing to do with nutrition. Don't worry about it. You just get medications and you're going to be fine. You couldn't be farther from the truth if you think that, because all of the metabolomes being secreted by the gut microbiome are in response of the nutrition that you're putting in your body, period. I try to emphasize the role of nutrition in helping patients heal their gut. So based on the type of nutrition that one chooses to eat, you could either feed the healthy gut microbiome and contribute to health, or you could eat an inflammatory diet, the response of which will be producing inflammatory metabolomes. And you can choose what type you like. I choose to eat a whole food plant-based diet because we know that the gut microbiome, in response to eating all that fiber, produces short-chain fatty acids, which not only heal the gut, they prevent cancer, they prevent diabetes, they prevent metabolic disorders. They are the nutrition your colon, your gut cells need to thrive. And the more plants you eat, the more variety of the plants you eat, the more diversity of the gut microbiome you get, and the healthier your gut will be.
Isn't that great? I love that. I love that. Dairy should be illegal. It absolutely
should be. Dairy is racist, Lisa. How is it that dairy is legal in this country? In fact, why is the government encouraging people to eat dairy? You know, there are populations in this world who are about 98% of them are lactose intolerant. In some Asian countries, 98% are lactose intolerant. And there are in the African American population, over 90% are lactose intolerant. In the world collectively, about 65% or 68% of the population are lactose intolerant. And in that video, I rounded up to 70. But nevertheless, only a few Caucasian, Northern European populations can really handle dairy because they have a mutation, in which case they can digest dairy. But the rest of us are lactose intolerant. So why is it that the government is encouraging all people to consume dairy products where it's completely racist, right? Because most people cannot handle dairy and they get sick from it, right? And when the government recommends something, they should recommend it to the masses, something that's good for everyone, not just a few white people or Caucasian people, you know?
Exactly. And it is, I think Dr. Mills would call it institutionalized racism, because it's very hard not to get the dairy products if you have children in school, especially if those children are having breakfast and lunch. Now maybe that children are home, at least in many cities around the country. Hopefully they don't have to drink milk. But they are food insecure. Many of these kids are food insecure, so it really is a problem. But clearly, when you look at milk and you look at the macronutrients in milk, you're talking about the carbohydrate. And milk is the majority of milk is the carbohydrate that contains the lactose. What about the other two macronutrients? Can you talk a little bit about those and how healthy or unhealthy they are?
Well, milk which is cow's milk. We're talking about cow's milk right now, or you could talk about any mammalian milk that's not human. We're talking about cow's milk in particular at the moment. There are 3 macronutrients and there are hundreds of micronutrients that could be bad for the human consumption. If you think about the macronutrients, including the fats, the carbohydrates, and the proteins, it is not ideal for human consumption. If you think about the carbohydrate lactose, well, most of us cannot digest it because we are deficient in the lactase enzyme that breaks down the lactose, which leads to diarrhea, constipation, altered bowel habits, bloating, gas, and discomfort. And so that is very, very common. A lot of people have been diagnosed with irritable bowel syndrome, Lisa, but when they come to me and I ask them to stop consuming dairy products, they get better because they were lactose intolerant. They didn't have IBS in the first place. The proteins in dairy include casein and whey. Well, I find that a lot of my patients are allergic to casein and whey, and they present with this esophageal disorder called eosinophilic esophagitis. And there are a lot of people with allergic reactions, like sinus problems. I myself had eczema from it. So the proteins are not ideal for human consumption. Then you think about the fats. The main fat in dairy is saturated fat, which again is not great when it comes to the gut or for heart disease. So it's better if we just eliminate these types of macronutrients found in dairy. But also remember, there are a lot of micronutrients in dairy that are deleterious for human consumption, including hormones. I mean, who wants to feed their child, a boy, estrogen and progesterone? I wouldn't want to do that. I wouldn't want to feed my daughter dairy milk, which contains estrogen and progesterone that may lead to hormonal imbalances. That it basically, if you think about it, the only thing that dairy has been the point of advertisement, not for health, but just for the sake of having this micronutrient, is calcium. So the dairy industry goes out of their way to basically nail it in your head that dairy is good because it has calcium. But just because something has a particular macronutrient, it doesn't mean that it's healthy, because it comes with all these other bad things. So it's like, for example, you don't want to drink soda because it has potassium. You wouldn't want to eat dairy products or drink milk because it has calcium. There are other things that have calcium. You don't have to limit yourself to dairy because dairy is not good. And exactly. So that that slide is brilliant. It shows that this is from Switch for Good, founded by my friend Dotsie Bosch. Switch for Good is an awesome platform for you to get a lot of information. These are dairy-free athletes who've come together and they are saying no to dairy. So basically, if you think about it, if you have all these athletes trying to compete, right? And if they're drinking dairy, are they really drinking dairy, or are they just wearing the mustache to get paid? I think that they're probably wearing the mustache to get paid, because if you think about it, 70% of them, 60% of them go into the Olympics having diarrhea, massive bloating, gas, and abdominal pain. How could they compete?
They can't compete.
They're probably not drinking it or consuming it, but it's probably monetary reasons why they're wearing the mustache. So these athletes from Switch for Good are coming out and they're saying, no, I won that medal not because I drank dairy. It's because I put in the time and I ate a plant-based diet. And guess what? I did very well.
And let's tell everybody that Dotsie Bosch, the founder of Switch for Good, won the silver medal in cycling in the 2012 Olympics. And what's unusual about Dotsie is she competed against other women who were literally young enough to be her daughter. She was just under 40 years old when she competed. And many of the women that were competing were in their late teens and early 20s. And here she was, grandma almost.
Yeah.
Old enough to be
exactly. Can you imagine? I mean, she went plant-based 3 years before she won the medal, which was amazing. She got faster and faster.
Yeah.
And it's pretty incredible. So that slide you showed, how the dairy industry has ingrained in people's heads, they have associated, they have very good advertising. We have to give them that.
So pick something from the slide. What should people focus on?
Well, first of all, you look at kidney beans, tahini, almonds, dark green, leafy greens. They have more bioavailable calcium than the dairy. So if the dairy industry has done a good job associating calcium dairy in your brain, right? When you think about dairy, you think calcium. Let's change that paradigm, right? Why don't you and I try to teach one, if there was one thing we want people to take away from this, is dark green leafy vegetables have bioavailable calcium, right?
And that would be the exception. The exception would be spinach and Swiss chard, because those vegetables are excellent vegetables and excellent sources of iron, but calcium is bound to oxalate, so it makes them not a strong source of calcium. Doesn't mean you shouldn't eat them, but all of the other dark leafy greens such as kale and collard would be optimal for calcium consumption.
So for everyone listening today, we want them to associate calcium to dark green leafy vegetables. How's that?
I think that's great.
And from now on, if someone said, how are you getting your calcium? You say, I eat a ton of dark green leafy vegetables.
Exactly. So let's look at this one. This is a Switch for Good. This is a meme that you did for them. And it says, you can't expect to feel like $1 million if you eat dairy when all you can expect is our digestive problems.
Yes.
And what kind of digestive problems do people?
Well, you have to talk statistically speaking. Like I said, 60 up to 65% of the population in this world are lactose intolerant, and some populations are 98% lactose intolerant. So you definitely, it's almost hard to feel like $1 million when you're consuming something that is deleterious for your gut and for your heart. So what you can expect, the majority of people will have abdominal pain, massive gas and bloating, which is just lovely, isn't it? Imagine you're going to a nice party and you put on that tight dress and you decide you're going to drink a glass of milk and then you can look pregnant in your dress. That's lovely, isn't it? You can expect constipation, diarrhea, and all kinds of awful symptoms.
And I think the bloating probably bothers women the most, because it's like, wait a minute, what happened? So, and now let's talk about cancer. Now, I just want to let everybody know we have a special guest towards the end of our show today. Dr. Christy Funk is going to be on. And in honor of Dr. Christy Funk, I want to put this one up. So this is a Switch for Good meme that she did. And she's a board certified breast cancer surgeon. And she says, breast cancer patients eating one or more daily serving of high fat dairy, cheese, butter, cream have increased all-cause mortality by 49% compared to those consuming less than half a serving per day. Ditch the dairy. Dr. Christy Funk, and she's going to be on in about 10:45. We're gonna add her to the show, but I just wanted to say how important it is, because the risk for breast cancer and prostate cancer goes up exponentially with consumption of dairy products. And maybe she can give us some specific data when she comes on.
I think the dairy products should come with a label. This is carcinogenic. This could be carcinogenic. Some kind of a warning, right?
Actually, Physicians Committee for Responsible Medicine did petition the FDA to put warning labels on cheese. And that's still in the process of being worked out, but they would like to see warning labels on cheese. I mean, you have warning labels on tobacco. Why aren't there warning labels on cheese? And that's probably the biggest source of all of these concentrated, terrible nutrients that come, I hate to even call them nutrients, but components, that is because cheese is concentrated. So it's not just the milk. It's like 5 times the milk in a much smaller portion. So, everybody talks about fiber and the gut microbiome. I thought we'd start with this slide here that talks about that. Can you explain this, Dr. Sadeghi?
Yes, I mean, there's a lot of confusion about prebiotics and probiotics, so I'm glad that you're showing this slide. So what happens when you ingest dietary fiber, which could come from fruits, vegetables, nuts, seeds, legumes, and grains? What happens is a lot of these carbohydrates escape digestion in the duodenum and proceed to go on to the colon, where they go through a process of fermentation by the gut microbiome. So fiber is called a prebiotic. And what happens is this fiber feeds the gut biome that the majority of the gut microbiome live in the colon, and they ferment this fiber into something called short chain fatty acids. So that's why fiber is called a prebiotic. The bacteria are called the probiotic, which ferment the fiber. And then, of course, they produce metabolites or metabolomes, hundreds of thousands of them, which are called short chain fatty acids and other things that affect your body from head to down to your toe.
Okay, that's great. And let's talk a little bit about which foods are probiotics and which foods are prebiotics. Yeah,
going back to the last slide, Lisa, one of the things that has happened is the industry has caught on this and said, oh, look at that. The bacteria, the probiotics are beneficial, right? So let's bottle it up and sell it to people, right? Because the industry is always trying to find a way to make money. So right now, the supplement industry is a multi-billion-dollar industry trying to bottle up these probiotics to sell them. But, we don't have really good evidence that these probiotics that you're consuming actually end up in the part of the gut that you desire, number one. Number two, we don't know if they sit there and integrate with our currently found biome and produce health benefits. We don't know. The studies are so limited, and a few studies we have are actually showing that they do not have great effects. So in the meanwhile, people are skipping that step one, which should be the ingestion of dietary fiber, and they're basically eating terrible food, which are inflammatory, and then they're jumping into the second part, which is consuming the probiotics via ingesting these capsules and hoping that it's doing the same. Well, I can tell you there is really no scientific evidence, and there are actually some studies that are showing that probiotics may hurt you or harm you rather than help you. So we need to go back to the basics. We need to think, how can we prevent disease, and how can we nourish the probiotics that are living in the gut? And the answer is by eating a ton of fiber, plant-based foods. And even if you're consuming non-plant-based foods, it's best to keep it at the very minimum. And the majority of your food should be fruits, vegetables, nuts, seeds, legumes, and grains.
Absolutely. Now, can you let our audience know how many bacteria are there? Because when I first learned this, I was overwhelmed. I couldn't even imagine. Like, who am I? There's more bacteria than me. Can you talk a little bit about the sheer number of gut microbiome that resides in our gut?
Yes, there are 100 trillion gut microbiome living in your body from mouth to anus. And, the majority of them are in the colon. Nevertheless, they are dispersed from mouth to anus. And they have 100 times more genetics than your own eukaryotic cells combined. So they're very powerful in what happens biochemically in your and physiologically in your gut and in your body in general, because they produce metabolites that communicate with your brain, with your heart, with your lungs. So it's not just that these bacteria are sitting here and they're static. There's a lot of enzymatic reactions that are occurring. So, we should really not call them bacteria, Lisa, and I make that mistake myself all the time, but they're actually biome. The microbiome consists of viruses and fungi and protozoa and archaea and bacteria. So it's not just bacteria.
Okay.
There are the microorganisms, we should call it. These microorganisms live with us in a symbiotic relationship, and they could produce health or disease depending on what they're fed. So they're sitting there and metabolize. They're eating what you're eating, right? So if you're eating something healthy, what you're doing is you're producing enzymatic reactions with these biome, and they're producing healthy metabolites or metabolomes that help you. And if you're eating unhealthy stuff, they're also eating these unhealthy stuff, and through enzymatic reactions producing metabolomes that cause harm in your body. An example of this is, for example, let's just say you decided to eat green leafy vegetables today for breakfast because you wanted calcium. And what happens is these green leafy vegetables that contain a lot of fiber, which are prebiotic, they go and feed the biome, and these biome produce, through a process of fermentation, short chain fatty acids. And these metabolomes are healthy metabolomes, which can reverse metabolic, could potentially, the research is young on this, but they could potentially reverse metabolic diseases. They could be good for your brain. They could be good for your muscles. And they could actually, in the immediate sense, as they're produced, heal the lining of the gut. The other example is, let's just say, Lisa, you would never do this. I know that, but maybe you decided, you know what? Maybe you developed Alzheimer's last night, and you decided to eat bacon this morning. Because you want to get colon cancer, or maybe you just didn't know that saturated fat is bad for you, and maybe you didn't know that it doesn't have any fiber. You decided to just have bacon this morning. That bacon would go into the digestive tract, and basically the gut microbiome would get a hold of this food and produce what we call TMA, which then goes on to the liver to become TMAO, and that becomes toxic. So you see how whether you eat green leafy vegetables or you eat bacon, what you can do for your health. It's not just, and then most people who have this lifestyle, it's not that they just eat bacon once or twice. Imagine there's a cumulative effect. Every day they're eating bacon every morning for breakfast, and then they go on to have a heart attack at age 50. They go on to have diabetes, and they're sickly. And, I'm almost 50 years old. I'm 47 years old, and I feel like I'm 25. But, I don't put toxic stuff in my body every day. Imagine if I had for years ate sausage and bacon and eggs every morning. I mean, imagine the cumulative effect is tremendous, and it should not be ignored.
Right. And the idea, this TMAO is now, it's not even a hypothesis anymore. There's a lot of research to demonstrate that in fact is what happens. And it's the TMAO that becomes oxidized in the liver that then allows for plaque to lay down in the arteries. So if you want to stop plaque from laying down in your arteries, stop eating the precursors, which are carnitine, or the amino acids only found in flesh foods. So it's the bacteria, it's the microorganisms in our gut that convert the carnitine into this intermediate that facilitates laying down plaque in your arteries. So that's just a real simple fix. Just stop eating it.
Absolutely.
And the deposition of plaques will diminish. They will stop adding to it. Now, there are other things you need to do to get the plaques to disappear, but you're constantly adding to it if you continue to eat flesh foods every day, 3 times a day. That's why heart disease is our #1 killer. Let's look at this real quickly. Prebiotics versus probiotics. So the probiotics are fermented soybeans, which is natto, or coconut kefir, which is a fermented coconut yogurt type product. Tempeh is fermented soybeans. There's miso, there's non-dairy yogurt, there's kimchi, and pickled veggies. And those are all the probiotics. That's what your gut microbiome wants to eat. Those are the probiotics that help ferment. The prebiotics are what your gut microbiome wants to eat, correct?
Correct. So the prebiotics are fiber-rich foods and they get fermented. So the probiotics, these are fermented. The column on the left side, these are fermented foods. So remember, we talked about how ingesting probiotics may not help and may be deleterious for your gut health. Well, the question is, what about fermented foods? I believe that I have never seen any robust literature come out that has shown that probiotic-rich foods are actually beneficial. There's some evidence that they may be, but I really believe that we need more research to find out whether or not these are for sure life-saving or beneficial or health promoting. I think we need more research. We're at the embryonic stages of that, but I've never seen any literature that says probiotic rich foods are bad for you. Mm-hmm. So that's good. So they've been around for years and years. I myself love tempeh. I love kimchi, and so they have these, because they're fermented foods, they have these probiotics in them. So perhaps when the food is fermented, there is a variety of biome that's in that food, and perhaps that could be better than ingesting one type of probiotic or lactobacillus, because these foods may have the entire spectrum of the biome, meaning they could have viruses too, they could have the bacteria, they could have the fungi. So it's more like in concert, and it's more I don't know, it's just more balanced rather than just one or two strains that would be given to you in a pill form. So again, I've never seen anything bad about fermented foods. I've never seen a good robust research article that has shown that they're really amazing, where I just tell my patients, if you love it, eat it. If you don't love it, don't eat it. It's just up to you. But anyway, going back to that slide, if you could show, one should perhaps concentrate on eating the right side, which are the prebiotic rich foods. Like the writing is small and I can't see exactly what's in there.
It says asparagus, garlic, bananas, jicama, chicory root, Jerusalem artichoke, onions and leeks, and leafy greens and dandelion greens.
So these are great options because these are fermentable fibers that go onto the GI tract, into the colon, and get fermented into short-chain fatty acids. And that's where you get all of those health benefits.
Okay. Let's talk about leaky gut and an unhealthy gut microbiome. So can you explain how this happens and why it's a problem, and maybe if there's a relationship to various autoimmune diseases? That would be nice to know.
Well, of course. So if you look at the left side of this slide, it's you will see enterocytes, which are the cells with the little finger projections coming on top of them. These are enterocytes, meaning the cells of the gut. They have these microvilli, those finger projections, and they are in charge of increasing the surface area of the gut and being able to grab nutrients from everywhere to make sure there's no nutrient wasting, right? Because we don't want to waste calories, right? In the case of famine. So, what the gut needs to do is to jam-pack a bunch of surface area into a small area. So instead of it being flat, there's peaks and valleys, and these peaks and valleys grab nutrients. In between the cells, if you pay attention, there are 3 lines, which this is a schematic diagram, but of course these lines represent what we call tight junctions. These tight junctions are in charge of sticking these 2 cells together and disallowing anything to go through in between the cells into the circulation. The circulation is that nice pink thing at the bottom. And so the cells have to communicate with the blood vessel. And that the reason things end up into your circulation and go all over your body is because the cells communicate with those blood vessels. Now, the way that your gut, the inside of your gut communicates with the outside, with the circulation, is not through the tight junctions and in between the cells. Things are not allowed to travel in between cells because that could cause inflammation. What is supposed to happen is these finger projections or the peaks and valleys are supposed to take grab a nutrient and engulf it inside the cell and let the cell decide, oh, that's junk, it gets degraded. Oh, that's important, let's send that out. Or, let's increase mRNA expression to make healthy proteins, or let's decrease mRNA expression and just stay still. Or let's just kill this cell because this toxin that just came in completely destroyed the DNA. Now we have cancer. Let's just die because otherwise we're going to have colon cancer. So if the brain of the gut is via these individual cells, right? Now, what happens is if you don't obey this structure and what happens if these tight junctions break up, which is depicted on this right side of the slide, showing that the tight junctions are destructed. Furthermore, you can see the finger projections are shortened and flattened. So what happens is now you have these wide junctions where anything from your gut that is harmful, that is inflammatory, that should not normally have access to the circulation is getting access. Furthermore, you're seeing that the villi are destructed, so that means the surface area of the gut is diminished, and that way nutrients cannot be readily absorbed. This is a perfect example to talk about in the case of celiac disease, right? When people eat gluten, and there's an autoimmune reaction to gluten in the case of people with celiac disease, where they eat gluten, the body attacks the duodenal cells. And through this destruction, these finger projections get flattened. The surface area of the gut goes away, so they cannot absorb vitamin D, vitamin K, and these fat-soluble vitamins. And they cannot absorb iron, so they become anemic, and they get massive diarrhea, bloating, gas, or constipation. And they can get pretty bad nutritional deficiencies and GI problems. And you see the tight junctions are gone, and so inflammatory molecules can readily find access to the circulation and travel from head to toe. Now, if you go back to that slide, besides celiac disease on the right, this is what happens in the case of inflammatory bowel disease. These inflammatory molecules can readily find access in between, and what's not shown in here is a cascade of inflammation that could occur right underneath these cells before the circulation. So what happens is the circulation sends over cells and produces tumor necrosis factor and interleukin cells, molecules. And so the cells are swimming around in the blood vessel. I'm going to try to make this simple. They're just going their merry way, and then they see an inflammatory protein just literally walking through the tight junction, coming near the vessel. Well, they produce inflammatory molecules, and the inflammatory molecules go on into the mucosa where the cells are, and they start killing the cells off. And then there's a cascade of inflammation where basically your gut gets damaged, right? So having said that, the cascade could lead to inflammatory bowel disease. The cascade could lead to arthritis, autoimmune disorders. So that's why you may hear all disease starts in the gut, because perhaps it's the communication between the blood cells and the vessels and the cells and the inside of the gut, which is readily getting access to the circulation. So then the question is, well, how does the gut get leaky? Well, in the case of celiac disease, I explained, well, because you're eating something like gluten and your body is not liking it. But on a day-by-day basis, if you think about the majority of Americans and what they're doing to cause destruction of the gut, it's probably the consumption of saturated fat and the consumption of animal products. So there aren't that many there aren't too many human studies on this yet, but the animal studies are showing that when you give mice the standard American diet, what happens is that saturated fat destructs those tight junctions, causes leakiness, causes these tight junctions to break down, and you get leaky gut. And so if you put these same mice on a high fiber diet, they have shown that the mRNA expression of inside the cells goes up, and which codes for the proteins for the tight junctions, and the cells are able to rebuild the gut. And this takes a long time. It's not overnight. So if you went whole food plant-based tomorrow, you can't expect miracles. But over time, what happens is these tight junctions could come back based on animal studies. Okay, so anyway, what we have found, a high fiber whole food plant-based diet repairs these tight junctions, and a standard American diet, which is high in fat and mostly saturated fat, can karate chop these tight junctions and break them up.
And what happens in autoimmune disease?
Well, I mean, the thought is that you get the tight junctions, the integrity of the tight junctions become compromised, and then you get autoimmune disease. You see what I mean?
Because
and
you have large proteins now filtering through, and the body sees this big protein. It's like, what is it? It's a foreign protein. So the body then reacts to make an antibody against that protein. And one of the theories, and I don't know what the current thinking is now, but a few years ago when I studied this, one of the theories was that when casein happens to travel through the leaky gut into the bloodstream and it's not changed, that the body makes an antibody against it. And it turns out that on the surface of the pancreas are proteins that resemble casein in their structure. So the antibody that the individual's body makes to attack the casein then starts attacking the pancreas through a mechanism that Dr. John McDougall calls molecular mimicry. So it makes sense. It makes sense. So it's important to keep these junctions tight, to keep the inside of the body and the outside of the body separate. One of the things I learned when I learned physiology is that you're not in the body until you get out of the gut. So we're basically donuts from our mouth to the other end, and you're in the donut hole. So in the donut hole is not in the body. You're in the body when you get out of the donut hole. Does that make sense? You agree with that?
Yeah, okay. and you said it well. I mean, these proteins are not supposed to, big chunks of protein or amino acid chains are not supposed to enter the blood.
Right.
They're supposed to be broken down in the small bowel into small pieces, and these small amino acids are supposed to go through the cells and then get access to the body, rather than just readily move through the gut in between the cells, and that causes problems. And remember, you could cook your meat, but there is what we call endotoxins that travel in between these cells, lipopolysaccharides and endotoxins that can just readily get access to the blood system through the floodgates in between the two enterocytes. That should not happen. And if you have a robust gut, you get away from so much. Like if you have a robust gut microbiome, if you have a robust gut with normal tight junctions, you can get away with a little bit of a bad diet, because your body is resistant and it keeps repairing it. But it gets to a point where it's just like done. It just gets to a point where, you have these tight junctions that are broken, your gut is completely compromised, and then your body just can't handle it anymore. And then there's a cascade of inflammation.
Yeah, we know, and you can measure inflammation in the body. Let's talk about I hit something by accident. So sorry. All right. Let's go to the next. I wanted to do one more slide, and that's this one. People are interested in IBS and SIBO. So let's do that, and then I want to talk about your book, and then we're gonna move on. Maybe talk a little bit about the Academy of Nutrition and Dietetics. So let's just talk quickly about IBS and SIBO. Can you give a quick overview about that?
Yes, IBS, otherwise known as irritable bowel syndrome, affects millions of people out there. It's very common, and There's a new, there's a diagnosis that's been around for a while, but there's more focus on it now, called small intestinal microbial overgrowth. It's called bacterial overgrowth, but it should really be called microbial overgrowth. We're now looking at and comparing irritable bowel syndrome with small intestinal microbial overgrowth and thinking, wow, they could be along the same spectrum. So irritable bowel syndrome is usually, it's a disease that affects people and they have abdominal pain, bloating, gas, diarrhea, constipation, or alternating constipation and diarrhea. And these people have usually seen a doctor and other things have been ruled out. Like we know they don't have celiac disease. We know they have lactose intolerance. We know they don't have cancer. And then they get categorized as irritable bowel syndrome, which is a functional disease, meaning there's no architectural abnormalities in their gut. There's no masses or any cancers or anything else that could be confounding the diagnosis. So irritable bowel syndrome is a functional disorder. And, now we're figuring out that perhaps irritable bowel syndrome may be caused by a dysbiosis of the microbiome in the gut. So remember I told you there is 100 trillion gut microbiome living in your gut from mouth to anus. Could there perhaps be dysbiosis and imbalance of this gut microbiome that causes irritable bowel syndrome? It's possible. Small intestinal microbial overgrowth, or SIBO, can also cause similar symptoms. Gas, bloating are significant with patients with SIBO, but they have diarrhea, constipation, and all kinds of GI problems that are very similar to IBS. So, could they be the same disorder? It's possible, but then you have patients who have SIBO or SIMO, but they don't act like the IBS patients. For example, IBS, the hallmark is a lot of abdominal pain, diarrhea, constipation, or alternating diarrhea and constipation. With small intestinal microbial overgrowth, it could just manifest as bloating, but no pain. So it's very, so they're not the same diseases, but they're along the same spectrum, if that makes any sense.
Okay. All right. That's interesting. So you recently wrote a book. Can you tell us a little bit about this?
The Trifecta of Health, I was very ill myself. I was overweight or obese. I had severe eczema. And so this book came about when I started my plant-based journey and I started exercising avidly and not really that hard. I've always worked out, but I wasn't getting results. And I realized that it wasn't the intensity of the workout that was the problem. It was my nutrition that was the problem. It was a huge problem because I was putting my time in at the gym, but I wasn't getting results. I realized that when I fixed my nutrition, no matter how little or how hard I worked out, I was getting massive results. So I realized how important nutrition is in improving your health and improving your fitness. And then, of course, as I was aging, after age 35, your hormones, there's an age-related decline. And I realized with a little bit of hormone optimization, I was deficient in progesterone, so I was getting a lot of migraine headaches. So I studied anti-aging, and I realized, wow, with a little bit of hormone optimization, I was getting massive results. So I decided to write this book and call it The Trifecta of Health, because I realized for most women, the trifecta is, number one, first and foremost, nutrition. If you're not eating a healthy diet, forget it. You're not going to get results. The second most important piece of the puzzle is regular high intensity, low intensity, doesn't matter. Fitness is important. Fitness absolutely has to be integrated in your daily life. And number three, the hormone optimization. For men or women, after age 35, there's a hormone decline, age-related decline that you cannot escape. Because after age 35, nature wants to kill you. Because you're not reproducing most of the time, and there's really no reason for you to be on this planet Earth. So your ovaries start the production of certain sex hormones decline. And imagine 100 years ago, Lisa, you and I would not be having this discussion. Both of us would have been dead. Most people live to be 40 years old. We're living longer, and we're doctors, and we have a podcast, we are teaching and educating the public, we need to stay sharp, right? We can't just decline and go, well, I'm 47, I'm just going to sit home. You can't do that. I mean, I'm going to be a doctor for the rest of my life and practice to maybe even in my late 70s, right? So I want to make sure I stay
longer.
So that's where hormone optimization is important.
So I have the in the comments, we have posted the link, the Amazon link to your book. And I just wanted to spend maybe 1 minute on Institute of Plant-Based Medicine. So I'm putting a link up here. People can go onto the website and put in their email. Your website is not fully functional, but you are capturing emails so that you'll be able to communicate with them when you're ready to open. So tell us what the Institute of Plant-Based Medicine is.
Institute of Plant-Based Medicine will go live soon. Right now, my website is drangiehealth.com. Institute of Plant-Based Medicine is an awesome, it's my baby, I have to say. It's an all-encompassing health platform where you go in and you can get help from your favorite plant-based doctors. It's a multi-specialty practice, so we have a cardiologist, a rheumatologist, a family practitioner, an internist, a fertility physician. We have other GI doctors besides me. We have plant-based dietitians. So the idea is to bring all these wonderful plant-based health practitioners under one roof. So
I love it.
They can get the help they need.
So when do you think you're going to open your doors?
Well, so we're seeing patients as of August 1, but we're launching the website July 25th.
I love it. That's wonderful.
We're so excited.
Dr. Angie Sadeghi, thank you so much for being with us today. We can't wait to have you back. In fact, I've got some of your doctors scheduled to come on to Hey Doc, What's New in Plant-Based Medicine, and to talk about their contributions to Institute of Plant-Based Medicine. So thank you so much for coming on. I'm now going to add Dr. Christy Funk. There you are, Christy.
Hi.
Hello. I'm going to let you guys say hi to each other, and then I'm going to say goodbye to Angie, and we're going to talk about a couple things that are coming up. But thank you so much, Dr. Sadeghi. I call you Angie. We're really good friends, and thank you so much for spending all this time with us this morning. I think it was a great show, and I think you really shed some important light on a very important subject that affects us throughout our lifespan. So thank you very much.
Thank you. See you soon. Nice seeing you, Christy.
Bye. Oops, let's see. Where's bye? There we go. Hey, Funk. Thank you so much. I know you'd had an early morning case.
I did. I just got out of the OR. I may still have like hat streak marks or something on my head.
Well, thank you so much for joining us. So I did want to, before just to go, I wanted to get some information from you that goes along with this slide. So tell us about how deleterious dairy products are to breast cancer.
So it turns out they're quite deleterious, especially the high-fat dairy products. So your ice creams and cheeses and creams, butter, lard, trans fats are the worst, and then saturated fats come into a close second. So the slide quotes a study, LACE, Life After Cancer Epidemiology Study, where breast cancer patients eating one or more daily servings of high fat, but not the low fat dairy, increased all-cause mortality, as it says, by 49%, as compared to those consuming less than half a serving a day. So literally just one serving a day will kill you, maybe. So the interesting thing about, you wonder why. And if you look at all of the research, which I did in writing Breast, the Owner's Manual, you kind of go in with a bit of a bias. Once you know the negative effects of dairy overall on health, you want to see it like definitively proven that it like causes X% of breast cancer. And you never get a satisfying study like that. And in fact, when you look at dairy, you get confusion and contradictory conclusions. In other words, it seems that just intuitively, and once you have a basic science knowledge, you would think that the presence of hormones and growth factors like IGF-1, fat, chemical contaminants, the pesticide residues, the antibiotics, aflatoxins, the melamine, that would all lead to a proliferation of abnormal cells and cause cancer. But the studies are a bit all over the map. Some show a link, most show no link, some show a small benefit to dairy. And how could that be? It's because as much as we can vilify animal products, every once in a while, and you'll get something that you need, right? So we talked about, or you talked about with Angie, the calcium, where you get plant sources of calcium, but you do get it from dairy. You get vitamin D and butyrate and some linoleic acid. So it's thought that the benefits of those things counteract the negative list that I gave you in dairy in low fat. But there's a real, true evidence-based link between breast cancer and high fat. Another really good study comes out of Seattle research, and it looked at 4,400 breast cancer patients and followed them for 7 years. And 3% of those 4,400 developed a recurrence. And when you looked at high versus low consumption of fat, there was a 78% increase in death for those who had the highest trans fat intake. So to remind everybody, trans fat, now banned from processed food, is really only found in animal meat and dairy. And it's the absolute worst of the worst. But you were getting it all the time in cakes and donuts and even fried chicken, shortening, those foods. So 78% increase. If you just look at the saturated fat eaters, so now you're looking at your solids at room temperature fats, they had 41% more death than the lowest intake of saturated fat. So there definitely is a link. So one more reason to avoid dairy.
We don't need it, and it's not good for the environment. It's not good. We can be using the land in a much more efficient way. It's across the board. Not good for climate change. Not good for the animals. It's pretty terrible. So you are going to be. I wanted to bring you on today because you are going to bring one of the speakers at the International Conference on Nutrition and Medicine, and here you are, right next to between Dr. Michael Greger and Dr. Kim Williams. So we want to try to encourage healthcare providers, nurses, physicians, dietitians, health coaches, any of the people that are involved in providing care. This conference is for them. And there we are. We see you with, on the left, Dr. Kim Williams, who is the former chief of cardiology, or still is, I think, at Rush, but he was the president of the American College of Cardiology, and he's now a past president. We have Dr. Michael Greger on your right, and then we have Walter Willett, Dr. Walter Willett from Harvard, a physician and a very important public health figure. We have Dr. David Katz from Yale, and then we have Dr. Danielle Bellardo, who is going to be joining. She's a cardiologist. She just finished her fellowship, and she's going to be joining the Institute of Plant-Based Medicine, and she'll be going into practice with Dr. Sadeghi. So it's pretty exciting. But tell us about this, because you are a speaker. So tell us about the International Conference on Nutrition and Medicine and what you are going to talk about.
Okay, so it was going to be live in Washington, D.C., but obviously it's become an online. And I should mention there are CME credits for all those who are healthcare workers, but just everybody out there listening now who's like, I'm very interested in all this science. It's not going to be so sciencey that you need an MD to understand it. So I would say anybody who just wants to boost their knowledge, no matter what is your area of concern, it could be anything from metabolic syndrome or diabetes to cancer. And I have no doubt that topic will be broached. It's a 3-day conference, August 6th, 7th, 8th. I speak August 6th, 2 p.m. Eastern time. And I'm talking about breast cancer. Shock, I'm sure. But the fact that it is up to you, that there are so many controllable risk factors in our lives, predominantly diet and nutrition. They weigh, I would say, the heaviest on this scale of tipping you toward cancer or away, but also physical activity, obesity, alcohol, hormone replacement therapy, environmental toxicities, stress. These all contribute, but I'll be focusing on the nutrition aspect for the most of my talk. And it will be fun for listeners to start to see in the science how and why animal protein and animal fat is so toxic to the microenvironment that surrounds our breast cells. And it will be so empowering to realize how nourishing and anti-cancer the phytochemicals in our plant foods can be. So that's what I'm talking about.
And for anybody who's watching, you can see the banner on the bottom. The website is very simple. It's pcrm.org/ICNM. And you can register for the conference. There is a discount for medical students and residents in training with proof of education. It is a wonderful conference, and no, you will not be sitting the entire day. I interviewed last week, Dr. Neil Barnard was my guest. So we went over how they were going to do that. So basically, there are 2 speakers at each time slot, and then you pick one. And I mean, of course, I'm going to pick Dr. Funk because I want to hear what she has to say. But the other speaker, I haven't seen who's in opposition to you. But if I want to see the other speaker, I can watch those presentations for up to a month afterwards. So I may not watch them all in August 6th to 8th, but it's just a few hours a day. So you're not going to be sitting at your computer for 8 hours. I think it's 4 hours close to 4 hours of time. So I think they organized it very well. And then there's also nutritioncme.org, and some of these lectures will go up on nutritioncme.org subsequently in the year. I think it takes a few months to be able to get them. And there are CME credits and continuing education credits for that. So now I want to talk about this. Tell us about this.
The Cancer Kicking Summit. So we got bumped from April to October. It is live in person, but there's also on-demand video, so you can join either way. Probably a safer bet to do on-demand at this moment. This conference is really just an outflow of my heart. Like, it's an extension of who I am as a person and as a physician. And what we're going to do is talk a little bit about nutrition, of course, because it's so important. But this conference is much deeper than just food. We're really doing a dive into the soil of your life. We're going to root around in there, get rid of the negative thinking and the terrible habits, and really nourish that soil so we can plant what I'm terming 10 seeds to grow 10 trees in the orchard of your life, so you can have the most fruitful, bountiful existence possible. We're going to look at a lot of things like thinking, moving, relationships, certainly eating, but not eating. We're going to talk about the power of fasting, meditation. So there's a lot we're going to power through in a day and a half. And I know it will be transformative for anyone who attends, either in person. That resort, oh my goodness, it should be on everybody's bucket list. It's a Southern California.
Look at this. This is Palos Verdes Peninsula.
Yes,
and it looks like it's somewhere off the coast of Italy.
It does. And when you walk through the doors, you're like, did I just fly for like 80 hours to get to this magical place? So being
and I want everybody to see the website to register is very simple. You go to pinklotus.com/summit, and then it takes you, and I checked it this morning, it does work. It takes you right to registration, so you can pick the plan you want. So I'm very excited. I think that's wonderful. And I think, because you have so many incredible programs. I mean, not only do you provide breast care for women, but you have all these incredible, you have this buddy program, this companion program, where, can you talk a little bit about that? Because I think that sets you apart from the rest of the world in terms of services that you offer for support for women who are undergoing breast cancer at any stage, whether it's a very simple in situ stage 1 or it's a much more aggressive stage 3 or stage 4. Can you talk about that program and how you match people up and how it works?
Yes, thank you for mentioning it. So Breast Buddies, and you can find that pinklotus.com has a whole section called Power Up. It is a robust community, over 10,000 members, international. It's all free. And when you go around and rummage through all the different things that are in there, I think you'll be amazed at what you can find, breast cancer or not. This is really a site for all women to empower them with knowledge, with actual real-time social friendships and connection. You can do a GoFundMe type of fundraiser if you're in need of surgery or reconstruction or something and your insurance is limited. You can also go to Breast Buddies. So this is one of my favorite things that I've created in my lifetime. It used to be called Funk Buddies, but now it's much bigger than just my little solo practice. And what it is it's a matching system, not unlike Match.com, where you would go in either as a breast cancer thriver, been there, done that, and you want to be in the database because you'd like to be paired with someone newly diagnosed, looking for support. But what I've noticed in my practice repeatedly is that very well-intentioned friends and relatives of someone newly diagnosed will say something like, oh, yeah, my mom had breast cancer. Well, it came back and she died, but you're going to be fine. So they say these things that are just like, why did you eat that? And it really spirals a woman's mind to the worst case scenario in a moment that's already heightened with so much stress and uncertainty and anxiety. And really what you need in these early moments of a diagnosis is a like meets like. In other words, stage 1 cancer should talk to stage 1, and someone who needed chemo should talk to someone who went through chemo, and mastectomy should talk to mastectomy, because doing something else, pairing a stage 1 with a stage 3, the experiences are so wildly different that the advice is not relevant, and it can actually be harmful and anxiety provoking. So you go into Breast Buddies and you start with your age. So say you say 50 years old, 5 years from you, age 50 to 55, boom, everybody who's that age and is there because they've been there, done that, and want to talk to you will pop up. But then you put in chemo, and then some disappear, and you're left with your age group that went through chemo, and you can put in stage. There are about 10 different parameters that you can put in. And then you can look at a profile and say, oh my gosh, she has an 8-year-old too. I want to talk to her because I want to know how she dealt with telling her children. And it's just a really beautiful way to pair people for psychosocial support and friendship. I've had patients become best buds, go pre-COVID days on Florida vacations together. And it's really quite a special, sacred community.
Well, you are a special and sacred woman, and you are doing so many incredible things. And I just have to tell you, I talked to my Aunt Judy. Now, we talked about this before. My Uncle Mitch Carlin is somebody that Dr. Christy Funk operated with. He was a very well-respected breast cancer surgeon at Cedars-Sinai, and was chief of staff at Cedars-Sinai, and had all these incredible awards and accolades and things that he did. President of the LA County Medical Association, chairman of the Scientific Council for the American Medical Association. He was very political, but he was also a hands-on surgeon, and he loved medicine. He passed away, but you had the opportunity to train with him. And I mentioned to my Aunt Judy, and she goes, oh, I love Christy Funk. Oh my God, how is she doing? I had the nicest conversation. So I just wanted to let you know, my aunt said, I got to watch that show.
Oh, that's so sweet. Well,
so I'll play this for her and she'll get a kick out of it.
Yeah.
But anyway, thank you so much for joining us, for coming in to speak for PCRM. And it really, it means a lot to them. And I love getting a little refresher on breast cancer because it's something we really have to pay attention to. And you're right, we have some control. So thank you so much for being here. And I'd like to set up a day. We will coming up maybe before your summit, one more day where you can come on and have the whole show. We'll talk more about that. But thanks so much for being here.
Thanks, Lisa.
And thanks everybody for joining us. Next week, we have Dr. Carolyn Trapp. She is the Director of Diabetes Education at Physicians Committee for Responsible Medicine. She has more acronyms after her name than I've ever seen. She's actually a nurse, and she's a nurse with a whole slew of nursing degrees, and she recently got her DNP, her Doctor of Nursing Practice. But what's unique about Dr. Trapp, in addition to her being a level 5 diabetes instructor, is she has spent time with the people of the Navajo Nation, because the Navajo Nation has suffered seriously from obesity and diabetes and all the complications for diabetes. But now, recently, within the last probably month to 6 weeks, she was there working on COVID and strategies, because that segment of the population, because the comorbidities are so significant, they necessarily don't do well with COVID, because more comorbidities just statistically means people may not do as well if they unfortunately contract the disease. So we're going to have her on. We're going to talk about and see slides of some of the programs that she's done with the Navajo Nation. So please tune in next week, 10 o'clock, for Hey Doc, What's New in Plant-Based Medicine. And thank you so much for being with me today, Christy. And I'm Lisa Carlin, and I'm going to sign off now. Thanks so much. See you next week.